I'm going to not add to what our distinguished speakers have already said. There are a lot of problems that we've already talked about. There are a lot of solutions that they propose. I'm going to just focus a little more on one solution that I think may be a very important key component of whatever we are trying to do for Indian healthcare today, and that is the family doctor. What we're doing at Ross Clinics, and I'm going to talk about 4 or 5 different organizations also who are emerging in India right now. We're developing a solution for the urban lower middle class and the middle class, exactly to provide affordable care, to make quality care accessible to them and affordable to them. And the idea is not to go about that angle of how much we charge them or not to charge them, but to look at it from the angle of the trust and the relationship. If you remember, even 15-20 years ago, there used to be that family doctor. Every family would have one person that they could trust and go to and have that long-term relationship. And the doctor also knew everyone in the family. They would, not just their medical complaints, but also what was going on in their life. What did they like? What did they don't like? What are their aspirations? And somehow for the last 15-20 years that tribe, that institution is disappearing, and we think it's a big loss. We think we have to revive that, and we are working on reviving that. So we have built a model around that, and when I say we, I mean we are there in NCR region, Ross Clinics. There is Swasth India in Mumbai. There is Modern Family Doctor and Nationwide in Bangalore. There is HealthSpring in Mumbai. There is Express Clinics in Pune. All of us have somewhere between 6 to 20, 25 clinics, and we are still growing, and there is that hunger for growth. There is a realization that this is what we need to have in more and more numbers first, and then maybe think about the tertiary care. But yes, and as one of the I think Dr. Mukherjee rightly pointed out that all the segments of Indian healthcare need to be expanded in a very, very rapid fashion. I think from my perspective as a family doctor, I see that the family doctor, the general physician, is the core where things need to be strengthened the most and the first. And there are reasons for that. Why I say that. I think the first is, as I've said, the family doctor is the one person who the people can trust to be their guide. People have lost a lot of faith with the Indian healthcare system today. They are afraid to go to the doctor. They are afraid to go to the any hospital. And we need to revive that relationship. We need to revive the trust. Before anything can take place, any constructive solutions can take place. As family doctors, we are able to provide comprehensive care. So the person does not have to go running around. An elderly person has heart disease, he has sugar, he has joint pains, so he does not need to see 3 specialists. He can see one single family doctor. And if the family doctor thinks that he needs specialist care for one of those things, then he can refer them. So that the care is affordable from that front also. So you don't need to consult 5, 6 different physicians or specialists. You just see one single family doctor for pretty much all of your needs. Same thing, we see all age groups. So the whole of the family does not need to go to 5 different specialists, just because one is 2 months old and one is 80 years old. They can all go to one single family physician. And because we have a generalist viewpoint, we can provide a much better, I would say, angle to care. What I mean by that is, for undifferentiated illnesses like dizziness, let's say, or chest pain, we are able to look at the person as a whole and see, okay, is this a cardiological problem, is this a neurological problem, or is this something that the person is this a psychiatric problem and the person is actually stressed and we need to counsel him for that. So we can look at all of these angles, and they're not just theoretical and feel good angles. There are studies that have shown that if you spend more on primary care, if a family as a whole spend more on primary care, they end up spending much less on their secondary and tertiary care. Right? And that's huge. And as a system as a whole, systems that have more robust primary care tend to spend less on secondary and tertiary care as a whole, and overall system costs are reduced, and overall parameters are actually higher. Scandinavian countries, we take a lot of examples, they have a very, very robust primary healthcare system. UK has a very robust primary healthcare system. And it's not about making it free for everyone or for accessible to everyone, but if primary care, if family doctors are strengthened, we are able to take care of, we are able to drive the system cost down. A lot of things that we want to be happening in this area, medical education especially. As a medical student, I remember we were trained. I was trained in AIMS, and very fortunate for that. But the real learning, I think, happened in Balabgarh, where actually practiced and saw the patients in a primary care setting. And the learning really happened there, and I'm very fortunate for those 3 months of experience, and I would think most of my learning comes from there. But I don't think a lot of medical students are that fortunate in India these days. Most of our learning is happening in tertiary hospitals, and the focus is on learning more and more of diseases rather than that relationship, that being able to communicate, being able to understand where the patient is coming from and what the family dynamics of the person is, and be able to tailor our therapy, and I'm not talking about medicine only, our therapy as a whole, for that patient's milieu, for that patient's social milieu and the family aspects, and as person as a whole, and not just the particular disease. So I think medical students need to be trained more and more in these aspects, and that can happen only in clinics, not in a tertiary care hospital. We need definitely more doctors, we need more nurses, we need more support staff, we need more everything in India these days, right now. Definitely more family physician programs. It's unfortunate that doctors, after passing MBBS, feel so inadequate. Of course, all the organizations that I mentioned, we are working a lot to reverse that. We are working a lot to empower our general physicians to feel proud about what they're doing, and to kind of, yes, whenever they see the love and the respect of the patient, that's what they cherish the most. And we're encouraging them to adopt it as a career, being a family physician. But we need more formal training programs in family physician, family medicine as well. So with that thought in mind, I'll take the seat and wait for any questions. I'd love to answer those.
Thank you.